Hello dear students, today we'll see part 2 of vascular diseases of the CNS, cerebrovascular diseases, the intracranial hemorrhage, the hypertensive cerebrovascular diseases, trauma related injury and dural hemorrhage. Cerebrovascular diseases is the third leading cause of death, that is after heart disease and cancer, in both developed and developing countries. The cerebrovascular disease denotes any abnormality of the brain caused by a pathological process involving the blood vessels. The three basic processes are thrombotic occlusion of the blood vessels, embolic occlusion of the blood vessels, or a vascular rupture. So either there could be a thrombotic occlusion, embolic occlusion, or vascular rupture. The thrombosis and embolism causes loss of oxygen and metabolic substrates resulting in brain infarction. So there is reduced oxygen. Hemorrhage accompanies the rupture of vessels. So when there is a rupture of vessels, there is going to be hemorrhage, which will lead to direct tissue damage as well as secondary ischemic injury. Stroke is the clinical designation that applies to all these conditions, particularly when the symptoms begin acutely. So commonly we call it as stroke, but it could be any one of them: thrombotic occlusion of the blood vessels, embolic occlusion, or a vascular rupture. The cerebrovascular diseases have either hypoxia, reduced oxygen supply to the brain, or ischemia or infarction, and they are seen as two types: global cerebral ischemia and focal cerebral ischemia. In global cerebral ischemia, the pattern of widespread ischemic hypoxic injury occurs when there is a generalized reduction of cerebral perfusion, usually below the systolic pressure of less than 50 mm of mercury, such as in cardiac arrest, shock, and severe hypotension. So if the blood pressure goes very low, below than 50 mm of mercury, the systolic pressure, then we may fear or we should be take care about the cerebral perfusion. There could be a massive reduction of the cerebral perfusion, and that could lead to global cerebral ischemia. The focal cerebral ischemia, focal, is cerebral arterial occlusion which leads to focal ischemia. Most commonly, causes are due to in situ thrombus formation, or an emboli from the cardiac mural thrombi, and atherosclerotic occlusions. So this is the difference between the global cerebral ischemia and focal cerebral ischemia. Cerebral infarcts as a result of arterial thrombosis or embolism. So you can see some of the infarcts over here. Here you can see the middle cerebral artery infarct. Now let's look into what is border zone or watershed infarct. The bilateral symmetric dark colored discolored areas seen superiorly and just lateral to the midline represent recent infarction in the watershed zone between the anterior and middle cerebral arterial occlusion. So you can see in this section, this is a cross section or a transverse section. Okay, so let us understand, like this will be the area of the anterior cerebral artery. This will be the area related to the posterior cerebral artery, right? Posterior cerebral artery supply over here. This is the middle cerebral artery supply over here, and this is related to the anterior cerebral artery. Okay, so you can see that here this purple colored areas. Okay, and here also we can see purple colored area. So that shows that this is the watershed zone between the anterior and middle cerebral artery. And here the one posteriorly, it is related to the watershed zone between middle cerebral artery and the posterior cerebral artery. Such watershed infarctions can occur with relative or absolute hypoperfusion of the brain. Okay, so when there is less perfusion, then this can be seen. Here we can see this is actually a coronal section, in which we can again notice these regions which are the watershed zone. So again between the you can say anterior cerebral artery here, and this will be the middle cerebral artery supply. So it is between the two. We can see that there is watershed zone infarction. It shows that there is a recent infarction. Now coming to intracranial hemorrhage. Intracranial, the word means it is within the cranium, so it's below the skull. And you know the different parts of the what you have seen in the diagram. Here is the skin of the scalp, then just it is covering the periosteum, and then you have the bone, which is called as outer diplo and inner diplo, and then you have the three matters, that is the meninges. First one, outer one, is called dura mater, then you have arachnoid matter, and then pia mater, the innermost. The dura mater is further divided into periosteal and meningeal layer. Periosteal very close to the bone, meningeal layer very close to the towards the arachnoid. Then then you can see arachnoid and then pia mater. We can also see some projections. These are called as arachnoid villi, which enter into the superior sagittal sinus. And this is important to know, the fox cerebri, which separates the two cerebral hemispheres. These are folds of the dura mater. And always remember, the subarachnoid space contains the cerebrospinal fluid. Okay, now this is the inferior surface of the cerebral hemisphere, or the ventral surface we can call it. So we can see that there are two systems which actually supply the brain. We have the vertebral system, that these are the arteries which you are seeing here. This is the vertebral system. Okay, and this is the internal carotid artery. So the two vertebral arteries, they join to form the basilar artery. Okay, they join to form the basilar artery. It also gives other branches, that is the anterior inferior cerebellar artery, then posterior inferior cerebellar artery. Okay, and also the anterior spinal artery. Anyway, these are all related to the supply before it goes to the actual part of the cerebral cortex. Okay. Okay, next we can see that you have the posterior cerebral artery. It's important to know the posterior cerebral artery. So basilar artery, then here you can also see the superior cerebellar artery. So the cerebellum is supplied by superior cerebellar artery, anterior inferior cerebellar artery, posterior inferior cerebellar artery. Okay, then there is posterior cerebral artery, which is a branch from the vertebral artery. Okay, posterior cerebral artery. Okay, now coming to the internal carotid artery. Internal carotid artery gives the middle cerebral artery. Okay, this is the middle cerebral artery which is going into the lateral sulcus. As you can see, this artery is going inside like this. This is the middle cerebral artery. Then you have anterior cerebral artery. Okay, it gives anterior cerebral artery. Now the anterior cerebral artery of one side, anterior cerebral artery of the other side is having a communicating branch between them, that is called anterior communicating artery. Anterior communicating artery. Whereas from between the middle cerebral artery and posterior cerebral artery, there is another communicating branch which is called as posterior communicating artery. Now all together of both the sides, right and left together, form the circle that is called as circle of Willis. Okay, so with this knowledge we will try to go within. In this photograph we can see the two types of intracranial hemorrhage. One is the subarachnoid hemorrhage. So when you see with the name, you can understand subarachnoid, it is below the arachnoid. That means it is between arachnoid and pia mater. Okay, subarachnoid hemorrhage. Then we can also see intracerebral hemorrhage. Intracerebral, so inside the cerebrum. Okay, inside the cerebrum. This is probably a branch of the middle cerebral artery. Okay. So we have this intracranial hemorrhage of two types, subarachnoid hemorrhage here and this intracerebral hemorrhage. Again we can see the subarachnoid hemorrhage here, and this is actually the intracerebral hemorrhage, mainly by the middle cerebral artery. Middle cerebral artery gives the thalamostriate branches to all these basal ganglia, nuclei of the basal ganglia. It's very important. And we can also notice an aneurysm at this location, which could rupture and could cause this kind of a hemorrhage. Now the hemorrhage within the skull can occur in a variety of locations, and each location is associated with a set of underlying causes. So hemorrhages within the brain itself can occur secondary to hypertension. So now if you have an increased blood pressure, okay, hypertension, secondary to hypertension, there can be hemorrhages. Or other form of vascular wall injury, atrio or arteriovenous malformation, then cavernous malformation, and an intraparenchymal tumor. Intraparenchymal tumor means tumor within the brain substance. Subarachnoid hemorrhages are most commonly seen with the aneurysm. So you usually can see subarachnoid hemorrhages with aneurysm, but it may also be due to other vascular malformations. So hemorrhages associated with the dura, okay, it is either called subdural, so it is below the dura, that is between dura and arachnoid, or epidural, that is above the dura, between the dura and the skull, make up a pattern associated with the trauma. So there are three types of hemorrhages we are noticing here. One is the hemorrhages inside the brain substance, okay, and usually it is secondary to hypertension or anything related to the vascular wall injury or a tumor, intraparenchymal tumor. Whereas subarachnoid hemorrhage are usually seen with aneurysms or also can be seen with vascular malformations. The hemorrhages related to dura is usually related to a trauma, okay, either it is subdural or epidural but related to trauma. Intracranial hemorrhage, you can see a cerebral hemorrhage. It's a massive hemorrhage which you're seeing here. Okay, so massive hypertensive hemorrhage, it has ruptured into a lateral ventricle. Okay, so usually you're supposed to see the lateral ventricle. This is the anterior horn, okay, anterior horn over here. Then these are the other parts of the lateral ventricle, but it's all obscured with the presence of this massive hemorrhage. Primary brain parenchymal hemorrhage. So this is the hemorrhage which is occurring inside the brain. Spontaneous, non-traumatic. It's not related to trauma. Intraparenchymal hemorrhages occur most commonly in mid to late adult life, with a peak incidence at about 60 years of age. Most are caused by rupture of a small intraparenchymal vessel. Hypertension is the most common cause. Hypertensive intraparenchymal hemorrhages typically occur in the either in the basal ganglia, it could be in the thalamus, pons, and cerebellum. Intracerebral hemorrhages can be clinically devastating when it affects the large portions of the brain and it extends into the ventricular system. This can also be seen in a CT or an MRI imaging. Intracranial hemorrhage, which is related to subarachnoid hemorrhage and saccular berry aneurysm. The common cause of subarachnoid hemorrhage is rupture of a saccular berry aneurysm. So we already saw what is the circle of Willis. Now if you have any aneurysm at this location, and usually the shape is like a berry, so it's called as a berry aneurysm, saccular aneurysm. Rupture can occur at any time. Commonly it occurs when there is acute increase in intracranial pressure, when the intracranial pressure increases, such as while straining at stool or sexual orgasm. They can have a sudden excruciating headache. It's classically described as the worst headache I have ever had, and he rapidly will lose consciousness. So it starts with a increased headache, and then the patient is going to lose consciousness. 90% of the saccular aneurysm occurs usually in the anterior circulation, that is related to the internal carotid artery, the branches, the anterior cerebral artery and the middle cerebral artery. So it could be here, anterior communicating artery, you can see one aneurysm over here. We can also see another one at the middle cerebral artery. Okay, so these are the anterior circulation. This is related to the anterior circulation. It's more common when compared to the posterior circulation, where there are other locations also we can see in this diagram. Near the posterior inferior cerebellar artery, pica, near the vertebrobasilar junction, near the basilar artery, okay, and also the internal carotid artery and posterior communicating artery junction. So these are the other locations, but it's related to the posterior circulation. This is how it looks like. This is how the berry aneurysm can look like. This is a dissected circle of Willis, which is showing a large aneurysm, and this is the view of the base of the brain showing the circle of aneurysm with an aneurysm of the anterior cerebral artery. Okay, remember, it can rupture at any time, especially when the intracranial pressure is high. The effects of the hypertension on the brain include massive hypertensive intracerebral hemorrhage. There could be a lacunar infarct, there could be a slit hemorrhage, and hypertensive encephalopathy. Hypertension affects the deep penetrating arteries and arterioles that supply the basal ganglia and hemispheric white matter as well as the brainstem. Lacunar infarct, which is a small cavity infarct which is less than 15 millimeter, it can occur mainly in the basal ganglia and the thalamus. Slit hemorrhage, rupture of the small blood vessels. The hemorrhage resorbs and leaves a slit-like cavity. That's why it's called slit hemorrhage. Acute hypertensive encephalopathy, characterized by diffuse cerebral dysfunction. You have headache, you can have confusion, vomiting, convulsions, that is seizures, and coma. Now, trauma-related injury. The effect of the trauma to the brain and the spinal cord depends on the severity and site of injury. The injury of several cubic centimeters of the brain parenchyma may be clinically silent if in the frontal lobe. It can be severely disabling if it's in the spinal cord, and it can be fatal if it is involving the brainstem. The traumatic parenchymal injuries, when there is an impact of an object with the head, injury may occur from the collision of the brain with the skull at the site of the impact, and this is called as a coup injury, or on the opposite side, which is called as a contra coup. As you can see in this diagram here, this is the frontal lobe injury, and here this is a coup injury at the site of the impact. Here also there is one which is hitting right above, so probably this is related to the parietal lobe and some part of the frontal also. Here the brain, he has hit himself against a wall, and you can notice that though this is the place of injury, but there is a contra coup over here. Okay, so contra coup on the opposite side. On the opposite side there has been a damage. So both coup and contra coup lesions are called as contusions. We can see a few lesions here. Here in this you can see temporal lobe lesion. Okay, temporal lobe lesion, and here we can see that there is a frontal lobe lesion. Okay, now if it is related to the dura, traumatic vascular relation injuries related to the dura either can be epidural or it can be subdural hematoma, and we said it's related to the trauma. So epidural hematoma is usually arterial blood. The vessels that run in the dura, it's called as the middle meningeal artery, are vulnerable to injury, particularly with skull fractures. The bleeding occurs above the dura, that is between the skull and the dura. As you can see in the diagram, this is the scalp, this is the skull, and this is the dura below. And in between the two, we can see bleeding. Okay, bleeding is there between the skull and the dura. Now the subdural hematoma. Subdural hematoma. It is usually venous in blood. The rapid movement of the brain that occurs in trauma can tear the bridging veins that extend from the cerebral hemisphere through the subarachnoid and subdural space to empty into the dural sinuses. The bleeding into the subdural space between the dura and arachnoid. So here we can see that this is the dura and then this is the arachnoid, and in between the two we can see bleeding. So the bleeding is between the dura and the arachnoid, and it's called as subdural hematoma, and it's related to venous blood. Here again we can see the subdural hematoma between the dura and the arachnoid, between the dura and the arachnoid. Okay, and it's due to the tearing of the veins. Okay, tearing of the veins which enter into the sagittal sinus. Here we can see this hematoma which is formed. It can also cause either subfalcian herniation below the fox cerebri. Okay, there could be herniation of the cingulate gyrus and the anterior cerebral artery. There's a threat, and there's also a threat of transtentorial herniation. So this part of the uncus, this the part of the temporal lobe which is related to this region, to the tentorium cerebelli, can also go for herniation, and it can also affect the posterior cerebral artery which lies in the calcarine sulcus. We can also see that this is the dura mater which you're seeing here. So since this is a dura mater, and if you see a hematoma above the dura mater, that it has to be epidural hematoma. And here the dura mater is removed. Okay, and what you are seeing, this the inner layer, this is the arachnoid mater over here. So it is above the arachnoid mater, such a huge hematoma we can see. That is a subdural hematoma. Subdural hematoma, and it is caused due to venous blood. Okay, it is tearing of the veins. whereas the epidural is related to the middle meningeal artery injury. Here, chronic subdural hematoma shows thick exterior membrane, that is what you're seeing here, the A, which is a thick exterior membrane, and there is a thin inner membrane, and this is a thin inner membrane which you're seeing. So anatomically, we can also try to identify 5 different areas, from ranging from outside to inside. So the first one is related to the scalp. Okay, if you remember the 4th layer of the scalp, that's the first area, just deep to the aponeurosis. The second area will be the related to the fracture of the skull bone, so this is the epidural. The third area is the subdural, between the dura and the arachnoid, and it is related to tearing of the veins. The fourth one, okay, is subarachnoid. The subarachnoid is between the arachnoid and the pia mater, okay, and injury probably is due to aneurysms. And the fifth one is intracerebral. It is due to rupture of the blood vessels, and probably it is due to hypertensive changes, secondary to hypertensive or vascular malformations. So here you can see that these are the 5 areas which have been mentioned to you. I will also be giving you the link to this PDF if you would like to download it. The loose area 1 is the loose connective tissue. It's also called as L, out of scalp, and that's the danger area. In scalping injuries, this is the layer in which the separation occurs. Infection can easily spread in this layer, and it's usually due to blunt trauma, and blood usually passes downward into the face and it causes black eyes. Area 2, which is rupture of the middle meningeal artery, fracture of the inner table of the bone. It is extradural or epidural hematoma, and under pressure the blood progressively separates the dura from the bone. Area 3, it is related to tear of the cerebral vein, or the veins which are emptying into the venous sinuses, where it crosses the dura to enter into the cranial venous sinuses. It results in subdural hematoma. It separates a thin layer of meningeal dura from that which remains attached to the periosteal layer. As a result, the hematoma is covered by an inner limiting membrane which is derived from the meningeal dura. Area 4, which is the aneurysm, and it could be a subarachnoid hemorrhage, ruptured aneurysms of the vessels of the cerebral arterial circle, that is circle of Willis, hemorrhage directly into the subarachnoid space and the CSF. So in this condition, the CSF will be blood stained. Area 5, which is the intracranial or intracerebral hemorrhage, is usually secondary to the hypertension or other vascular wall injury, arteriovenous malformation, cavernous malformation, or intraparenchymal tumors. So we can again see the areas. So here this is this is the nose over here, okay, and this is the posterior aspect, okay. Here we can see like this is area number 1, okay, if it is going to affect the scalp. This is area number 1 that is affecting the scalp and the loose connective tissue, so that is layer 4, and it can cause black eye. Number 2, this is called as epidural or extradural. It is between the skull and the dura mater, okay, and it's usually caused due to the injury to the meningeal artery, which you can see here. This is the meningeal artery, okay, fracture of the skull, injury to the meningeal artery, okay. The next one, area 3, as we can see that the dura is lifted, okay, so area 3 will be here at this location, area 3. It is between the dura and the arachnoid, matter. As you can see in this diagram, actually the blood vessels are still there, so this is the arachnoid matter present on this plastinated specimen. This is subdural hematoma, and it is usually due to the tearing of the veins which empty into the superior sagittal sinus, and it can later on cause subfalcian herniation, or it can cause transtentorial herniation. Okay, next, area number 4. So area number 4 will be between the it is called subarachnoid, right? Area number 4 is subarachnoid. So it is between arachnoid and pia mater. Arachnoid and pia mater, especially related to the circle, cerebral arterial circle. Okay, and area number 5 is quite deep within. So this area number 5, intracerebral. Area number 5 is intracerebral. Okay, and probably it's related to the middle cerebral artery. Okay, and it is secondary to hypertension and vascular malformations. Okay, thank you for listening.